Welcome to another episode of Chill with Bill, and today we are at Natural Bridge Caverns, Texas' largest and most spectacular underground attraction. And today we're about 150 feet below the Earth's surface in a cool room called Castle of the White Giants. And I'm here with Orthopedic Spine Surgeon, Dr. Swann. So welcome. How are you doing today?
Doing great.
Yeah. You've been here before, right?
I have.
It's a great place to come visit, take the kids, and
Oh yeah, I've been here with the kids before. They love it.
our backdrop today is a really cool formation. It's called the Watchtower, and it's 50 feet tall. I know the human spine's somewhere, around 24, 28 inches. What does a column or what does a spine do for our body?
It's a structure of protection. It also is a structure that provides the framework that the rest of our skeleton uses, attaches the rest of our skeleton so that we can use those limbs.
Well, obviously, if you're involved, something has gone wrong in the spine. So maybe tell me a little bit about some of the conditions that you see and treat.
What brings people into my office mainly are degenerative type things. As we get older, the joints in our spine can wear down. And generally what that affects are those nerves that we just talked about. What can happen is arthritis develops. When that arthritis develops, it can start encroaching in on where those nerves are. When that happens, those nerves can get pinched. When those nerves get pinched, that causes pain. You feel it.
What type of surgeries are we talking about? What do you do to the spine to take away some of the numbness, the pain, and so forth?
Generally, surgery is done to achieve three goals. One, get the pressure off of the nerves. Two, if there's any kind of instability, you restore that stability. Three, restore the normal anatomy in the spine. So generally what can be done is if that arthritis is built up, we can take that arthritis away surgically remove that overgrown bone. If there's instability, we can stabilize that with things like screws, rods, metal. And then if there's changes in the anatomy that need to be corrected to restore that normal anatomy, there are other things we can put in. There are implants that we can put in to help realign the spine.
At the Baptist Orthopedic Hospital, we do a lot of spine surgery, right? Take care of people.
Oh yeah.
Do you have any special equipment there that's maybe interesting that people would like to hear about?
We have recently acquired robotic technology there to help facilitate using those screws and rods that we just talked about. We have navigation systems that allows us to create a 3D map of the spine intraoperatively. So when the patient's on the table, instead of just using traditional methods, which is two-dimensional x-ray, we can create a 3D map of the spine while they're on the table. So when we're putting the screws in, we can see them go in real time. That way we know exactly where the screw is going.
What do we do to protect our spine so we can avoid spinal surgery?
Just like anything, maintaining a healthy lifestyle. Strengthen surrounding structures. Keeping your core strong, that'll help protect the joints of your low back. Other healthy activities in life, avoiding smoking, avoiding unhealthy foods. All the things your primary care doctor tells you to do, that'll help protect your joints, slow down that degenerative process we talked about.
Yeah. Dr. Swann, from an age standpoint, typically what age group do you treat?
I have an adult practice, so 18 to 120.
What's the typical recovery process? How long does it take? What do people do?
Well, it depends on the magnitude of the surgery. Generally, after a spine surgery, we're looking at 2 or 3 nights in the hospital. It's generally a 6-week period of no lifting more than 10 pounds. You limit the bending and twisting in your back. Sometimes you're wearing a brace on your neck or your back, depending on where your surgery was. Full recovery generally is 6 months to a year. And the reason for that mainly is muscle recovery. So, spine's one of the most protected parts of your body. It's surrounded by lots of muscle and other tissue that I have to get through to get down to the spine to do my work. And so it takes time for that to recover. That time frame, like we said, anywhere between 6 months and a year. But a lot of that recovery is front loaded. And a lot of that pain that you came in for, the nerve pain, that goes away pretty quickly.
Dr. Swann, thank you for coming out to Natural Bridge Caverns and chilling with Bill.